Good afternoon. Welcome to the Point of Care Lipid Station. So at this station, what we do is we're going to basically just take a little blood from your finger, and we're going to run it through these analyzers, and it's going to give you a readout of your blood glucose as well as some lipid markers, so your cholesterol, your HDL cholesterol, your LDL, and a couple other interesting numbers. Is it okay if we get started with that? Mm-hmm. So I'm going to need one finger to use. So let's go ahead, and I usually like to take either this finger or the fourth or the third digit. I'll go ahead and take the third on him. And so once we have all our materials set up here, it's convenient to have them all laid out in an organized fashion, because if you don't, what happens is you're fumbling around. So this is recommended to set your station up because of how many materials we have. So from here, before I actually prick the finger, I'm going to just go ahead and clean it. And of course, my hands are sanitized, and I'm all gloved up. It's important to clean the finger well, the one that you're going to use, but also wait a little bit, just a few seconds, so that it dries. Don't just stick them right away, because that won't feel good. So from here, now that it's all clean, what I'm going to just make sure to do is turn on both my machines. So here, I'm going to open up the lipid panel test strips, stick in this little chip to the top, press any button to turn it on, and wait until it gives me a signal here. It says insert strip, so I'm going to go ahead and just take one of these strips for the lipid panel. I'm going to place this right in here. And in the meantime, let's see, it's going to tell me to do. Now it's going to tell me to apply sample. So I'm already here. Now, this is for the lipids. I'm going to use this machine to take the blood glucose. So now I'm going to use these strips. Make sure to close both of these so they don't, humidity doesn't affect the strips. And I'm going to go ahead and put this in here, and it's blinking, and it's all ready to go. So both of these are saying apply sample, and so I can go ahead and do that. So now I'm going to take the lancet, and I'm going to take the finger that is now all clean. This is a sharp, so of course when it's done it goes in the sharps container. So it is going to just a little prick, it doesn't hurt too bad, but I usually try to stick on the lateral aspect, not in the center. It's a little bit less painful if you kind of stick a little bit to the side. 1, 2, 3. All right. So now immediately disposing that in the sharps container, we see a little blood there. You doing okay?
Yep.
All right. Sorry for that. I'll wipe the first drop off. This goes in the biohazard waste. And I'm going to go ahead and take this and just a little bit of blood, and that's all we need right there. So now I'm going to start filling this capillary tube up to this black line right here. And I'm going to take it right to this side. Notice how I'm just sucking the blood right into the tube by touching right on the side of the bubble here. Putting a little bit of pressure with my hand on his finger. It's really important to make sure you completely fill up this tube, because if not, you'll actually underestimate the reading here. Looks like I'm going to have to squeeze a little bit more here. It looks like it's right up to the line there. Would you mind just holding this on your finger for me? Just put some pressure on there, and I'll bandage you up in just a minute. What I'm going to do is I'm going to go ahead and just, in one smooth motion, drop all the blood on the strip. All right, there's a little bit left, but now it is testing. So we're going to go ahead and wait about 2 minutes. Of course, it should be thrown away. It takes about 2 minutes to read. In the meantime, I'm going to now bandage his finger. Ugh. Okay, so once we've obtained the patient's blood and the machines now have created or analyzed the results. Now we have both a glucose machine and the CardioCheck machine, which has the lipids. We have both of these machines giving us all the results. So on this form, first the patient's name and their ID number, which actually either come from the patient's bracelet or they usually carry around a booklet that has that information. I would ask them if they've been fasting for at least 8 hours. That's the recommended time. If they are not, then that's okay. We're just going to basically put the glucose in a different area of the form, and I'll explain that. You're also going to want to ask them if they have a history of cardiovascular disease as well as diabetes, and go ahead and circle those appropriately. So now what I'm going to do is go ahead and input the data that we just got. So first, I see his blood glucose currently is 111, so I'm going to go ahead and put that in. But of course, as this patient mentioned, he wasn't fasting before, so he ate about 2 hours ago, and so of course that's going to be a little elevated. So I'm going to write that in the section where it says random non-fasting glucose and leave the fasting glucose blank. In this case, now in this machine, this gives us the cholesterol is 147. So under total cholesterol, I'm going to go ahead and write that right here. HDL cholesterol is 51. Triglycerides, 141. LDL cholesterol, the calculated LDL, it just includes that here, is 69. And the non-HDL cholesterol, I'm going to just click once on this triangular button to move to the next form. And it goes, and down here I see non-HDL is 97. And now this is a completed form that then I would give to the patient. And if there's no more questions, then of course the patient is free to move on to the remainder of the stations and go from there.